my name is Jeff Kellebach. I'm an aging specialist with Johnson County. I want to welcome everybody to the Iowa Care Act celebration. It's a very cool event to be able to celebrate. I know this has been many years in the making between many organizations, and we'll be talking about all those groups, particularly AARP and Older Iowans Legislature. Wanted to thank Bob Welsh. Bob has been huge with putting all these groups together to have this event today, and it's been a big... It's very well deserved, because he also had a big part in promoting this legislature and helping getting it passed. I know he's been working on this tirelessly for years. I think I could talk for a long time, but you didn't really come here to listen to me talk. So I think what I'm going to do is I'm just going to introduce Anthony Carroll. Anthony is the Associate State Director for AARP Iowa. I'm going to let him introduce himself because he's much better at it than I am.
Thank you, Jeff. Thank you. And how about Hanford Jeff for bringing us together? So if you've not connected with Jeff already, I encourage you to do so, because we're going to be talking about CARE Act as one of the ways to support caregivers. But you're also going to meet a lot of groups that were integral to passing the CARE Act, and it's important to get to know them and the resource that they provide here in the Johnson County area and the radius around here, because we know what the legislation that we pass is just one small piece of what we need to do to better support family caregivers. And that's why we're here today, to talk about caregiving. And the CARE Act is one of the tools to try to help better support caregivers. And Jeff did kind of steal my thunder by starting by thanking Bob. We have a lot of great people who've worked on this, but I really appreciate Bob, not only all he has done to help get the CARE Act passed, and we'll come back to that, but to pull this together. I was here in Coralville for an event on prescription drug costs, the next thing up, trying to also lower prescription drug costs for our association. But Bob grabbed me and said, we really need to have a celebration for the CARE Act. And it was classic Bob. I said, let's do this. It was like, well, I think really education is what we really need to do in outreach. It's like, it's got to be celebration too. And I'm like, well, I'm a little hesitant to do that because, I'm about, anyway, but once again, Bob prevails, and celebrating is officially in the title. And it is, I think Bob's point is well taken. It's important to hopefully build awareness for those of you who are saying, what is the CARE Act? We're going to get to that in a second. But to take time to celebrate what the CARE Act is and what it means as not just what's accomplished and how much more needs to be done to support family caregivers. As Jeff said, my name is Anthony Carroll. I'm the Associate State Director for Advocacy for AARP. We have Carolyn Workington, one of our great volunteers with AARP, who was trying to introduce me with my full title, and then she just said, he's the lobbyist, and it's like, that's correct. You can just cut to it. I'm the lobbyist for AARP. That is correct, and I embrace that title. I'm pleased to have worked for AARP for over 14 years. I work on public policy, both the State House, federal, and even increasingly locally too. So I'm very honored to work for AARP, and we have, our state director always talks about we have between 360 and 370,000 members in Iowa, but we have a staff of 5. So we depend on not just volunteers, but people like you on any issue. So that's my kind of early part pitch. Get involved, whether you're volunteering, please tune into the issues. And we have state lawmakers here. And they will reaffirm what I'm going to say is making contacts on any issue is the only way that we can have success, especially the ones that matter to you. So on that note, before we get into the legislation, I'm going to go around later and have them share their thoughts, but I do want to introduce some dignitaries here. We do have State Representative Mary Mashers here. State Senator Zach Walls. And State Senator Kevin Kinney in the back. Thank you. And last but not least, we have David Lesh, who's a representative, works with Congressman Lobsak's office. Thank you, David, for being here as well. So now we'll get into the substance of what we're here for, and that is about supporting family caregivers and how the CARE Act does that, or seeks to do that. So I'll start by saying this is the birth month of the CARE Act. July 1st, the CARE Act went into effect. We'll come back again around to talk about what the CARE Act is, but we are really celebrating the effective date of July 1st. the first time it went into effect, and this will be the first but not last. Thank you to the partners who made it happen, and thank you to the Iowa lawmakers and the governor for signing this law and getting it passed. So it's a big thank you for the people that made it happen. So we're going to talk about the caregiving as a background before we get into the CARE Act history, what it is, what it does. And then we're going to build towards what it means now, outreach and education, that's part of why you're all here today, besides to hopefully get a good lunch, hopefully learn some things, and hopefully help spread the word on what we need to do with the CARE Act and beyond the CARE Act to better support family caregivers. As a starting point, I always say, I've been at the AARP and I've seen variations of this slide. So I start with this slide because it is, and for the folks here is, we've done a variation of surveys of AARP Iowa members and AARP members across the country. One of the kind of core values when we talk about long-term care, we know where people want to stay is in their homes and communities as long as possible, rather than going to a nursing home or assisted living. Now, those are programs that are sometimes important and if not essential, and sometimes you need that care. But as a starting point for our organization, we always start with providing, looking at where people want to be, which is to be able to stay at their home as long as possible with the help of a caregiver or someone to help them be able to stay at home. You need that team of support to be able to stay in your home. And that's really kind of one of the backdrops to this framework of I Heart Caregiving, I Heart Caregivers, and how the CARE Act fits into that. This is a famous quote. I'm sure some of you have seen this from Rosalind Carter. There are only 4 types of people in this world. There are those who have been caregivers, those who currently are caregivers, those who will be caregivers, and those who will need caregivers. And by the way, some of the times you fall into this more than one category at once. I see head nods, right? So it's really, the CARE Act is just one way to looking at how we can better support those caregivers who are providing care. And this is a reminder, when I talk to lawmakers, the lawmakers in here probably have seen and heard me make this pitch as a starting point. It's important when you're talking about long-term services and support, people's minds often go to nursing homes, assisted living. But the majority of long-term service and support is provided by family caregivers. That's the majority. 2/3 of it is provided by informal caregivers. And I say that family, it could be a loved one, it could be a neighbor, it could be someone from your church, your neighbor who helps you out. 2/3 of it is provided by family and friends. And that's even higher in Iowa without getting too far in the weeds. There's a CDAC program, consumer choice options, people who are family members but who get some compensation on top of it. That number jumps to 90% if you're talking about people who are loved ones who are help providing care. So caregiving in Iowa, some data points. There are about 317,000 family caregivers who do this every day in Iowa. This is what they do. So, by the way, this is their job on top of oftentimes another job that many of them have. So this is their unpaid job to care for a loved one at home. And if we paid them for the work that they do, unpaid, compensated, it would cost our state $3.9 billion. That's the value of the care that they provide unpaid. So again, if you were to hire someone to do what they do for the goodness of their heart, it would cost $3.9 billion. What it means to be a caregiver means a lot of things. Larger than the CARE Act, it means providing emotional support, helping for transportation, helping with personal care, bathing assistance, driving to appointment, care coordination, helping with medications, and other care is really what the CARE Act piece of it. But to personalize a little bit more, our most updated caregiver survey we did in November in Iowa, we always like to know what are the realities of Iowans, and especially those who are providing care. Nearly 4 in 10 Iowans, 40 plus, by the way, this is not a survey of 50 plus, but nearly 4 in 10 Iowans over the age of 40 have experience as family caregivers already. So 4 in 10 already have it. 2/3 have not been a caregiver, but again, so many of them understand, when you talk about 40 plus population, 4 in 10 of them, almost half of them, understanding that caregiving reality that faces them. So what does it mean to be a caregiver in Iowa? It means, I mentioned some of those, those task notes to provide companionship, to provide transportation. But in Iowa, what it means, 2/3 of what it means is providing medication management, helping oversee medications. I'm by the way, live in Des Moines. I'm originally Eastern Iowa, from McGregor. My parents are in their 80s. I help provide care for them, on and off. As another member of our family, my mother takes, I've asked she can share this, she takes 11 prescriptions. And that was, by the way, evolution. 10 years ago, she didn't take any. So it can be a complex task to help people, even with their medications. And then a majority of Iowans, 51%, my other little circle, have medical or nursing tasks as part of their job in Iowa to being a caregiver. That's also what it means to be a caregiver in Iowa. Again, not surprisingly, it's a labor of love, but it can be stressful. 2/3 of family caregivers in Iowa report being stressed out. And then 60% struggle to balance that job and family life that they have. A half struggle to get rest. So really, this is just some data points that point out the obvious if you've been in this role or have people around you. Caregiving can be stressful, and people need help. We mentioned that 4 in 10 said that they had been caregivers, but a majority of them understand that caregiving is probably in their future. So if they're not a caregiver now, going back to Rosalind Carter, they know that's probably coming for them. Again, one other finer point, 87% of caregivers learn by doing, right? That's, I don't know, especially the Iowa way, right? I'm a farm boy. You just kind of figure things out. You jump into it and figure it out after the fact. But 52% said they find caregiver to be overwhelming. And again, to reemphasize what it means to be a caregiver in Iowa, 65% are involved in some type of medical care, and 75% of Iowans said they would like more training and resources. And that's just one data point. Again, here's a nice portfolio that talks about what it means to be a caregiver. A typical caregiver in Iowa, majority are female, average age 62, caring for someone age 80 or plus. And again, a majority of Iowans actually work in a separate job. So in addition to their labor of love, they also have a actual job on top of that. So here's now we transition to why the CARE Act. Why the CARE Act? And we're building to what it means. There's lots of different groups that study care, study health care, and look at what are key points in care that things can go right or things can go wrong. And this healthcare benchmarks transition survey found that 50% of the time where things can go right and wrong, it's transitioning from hospitals to home. That little red thing right there, 50%. That's where it's such a key point in care where things need to go right rather than wrong. So our survey, we asked people in Iowa, how important is hospital discharge, not just to the patient, but to the caregiver. 67% say that's so important to have instructions as a caregiver, not just as a patient. And then we also asked them, how many of you have been in a situation as a caregiver where a loved one's been discharged and you've been with them? We asked them, of those people surveyed, 73% did get instructions on medical care they need to provide, so that's good. You can say, well, that's pretty good, 73%. But the flip side is 1 in 4 times of Iowans surveyed that in that situation, they were not provided instructions or demonstrations as a caregiver. So again, that was one of the really data points that realized we need to take a step to improve it. So here's what the CARE Act does. To unveil it, for those of you who are new to this, there are 4 pieces of the CARE Act that's as passed by law and evolved. And the purpose of the CARE Act is really as a high level to make sure that all patients have the option to involve caregivers and have those caregivers be prepared to provide care when a loved one's sent home from a hospital to home. So the first provision is it gives all Iowa patients the option to designate and record the name of a family caregiver upon admission to a hospital. That is so key because, again, from the get-go, it helps not just the patient, but the caregiver and the hospital to know what's the reality of the situation of this person who is likely returning home. The second thing is, I mentioned a lot of caregivers work. The second provision is there's a requirement that hospitals attempt to contact a caregiver before being sent home. And that's so key because, again, people are working. They need to have a heads up that mom, dad, my spouse is heading home, so I need to be prepared to be at the hospital. And then the heart of the CARE Act, and again, this is something that was evolved to get the language right and agreed to by everyone, was patient care needs discussion and the capabilities of that caregiver. So the hospital discusses the patient's needs and then the caregiver's capabilities and limitations. And why is that key? Because not every caregiver, you have some caregivers who are 10, 20 years older than the person providing care. So maybe if you're doing lifting, you're doing some intense injections, IVs, maybe you really need to make sure that you, if you didn't think about it already, you're seeking the help of a professional. So that caregiver limitation is the third component. And last but not least, training. So the hospital gives caregiver an opportunity to receive instructions on any aftercare care that they're going to need to provide at home. And I tell this anecdote that really talks about why this is so key to have this instructions happen in the hospital versus home. We had a volunteer from the Quad Cities who showed up, didn't know what we were working on our lobby day, but she quickly understood the importance of this legislation. She said, I understand this well. My husband slipped and fell in the ice in the Quad Cities. We got into the hospital, had great care at the hospital, and then was discharged the same day to go home. They were great, again, getting him into the car, but now I get home, and he has this big gaping wound, and I didn't think to ask questions. Well, how do I provide care? She went to Bed Bath & Beyond to ask the sales clerk, you know, can I give a shower? Can I give bath? What do you recommend? And she kind of laughs at herself, but that, again, we're doers in Iowa. We figure it out. And so really, the point of that story is there's a better way. Wouldn't it have been better for her to have at least been asked the questions, are you ready to do this at the hospital, so she can ask the advice of a professional? So the CARE Act is very straightforward, and there's overwhelming support. There has been for it to get this passed, 92%, 91%, 83% to get it passed. And it's something that's been passed across this country. This map is a little outdated. When we first had this map, I think we were at like 38, but if you look at some of these things as filled, Iowa is filled in, as well as North Dakota and Missouri are two states that have since joined the ranks, and actually Tennessee was the most recent one that did it as well, passed this law to make sure that there's a standard. And I will reference one of the partners who's not here, Danielle from the American Cancer Society of Iowa. She talks about the need for the CARE Act in simple terms as an example of having a chance to have equity. Wherever you are in Iowa, you have some type of guarantee that you're going to have a chance to get prepared to provide care. And I really like that equity term. And that's really, I would say the other thing is we're learning from other states that have passed this and states that have passed it. One of the things that's pointed out is, as a secondary effect, is hospital readmissions are going down. New Jersey, this is actually a study from a medical journal in Pittsburgh that talked about seeing upwards reductions of hospital readmissions by 25%. Here's the New Jersey example that says for between 2010 and 2015, they saw a reduction in hospital readmissions, and among the reasons why, they specifically cited the CARE Act, the hospitals, as being a reason why those readmissions are going down. So a brief journey of the CARE Act in Iowa. I will not bore you with the play-by-play of every month, every year. I'll just kind of talk about some key points. One of the key things, what was different in the last couple of years is there was a lot of discussion in both the House and Senate in 2018. And there was some real momentum in both the House and Senate. Unfortunately stalled. It did not pass last year. But it did really lead to a really key moment where the parties that were supportive of this, along with the parties who had some concerns, we sat down, we had a very good conversation on how do we achieve the outcomes that we want to have from a consumer side. At the same time, how can we work with hospitals so they feel comfortable with the language and that doesn't add an extra layer to what they're doing, but at the same time, making sure there's a standard. So that was a product that came as a result a little bit too late. I'm not a patient person, but as a result of it, it really carried over in momentum to this year. Both candidates for governor last year, candidate Hubble and Governor Reynolds, both did video voter guides where they talked about being supportive of the CARE Act. I think that helped as well. And then again, I'll reference in a bit some of the lawmakers who really were keys to making that happen. But the CARE Act did pass. It was SF 2010. It did pass this year, both chambers. But it's passed not just because lawmakers. This is the point of the conversation where I want to bring in and turn it over to some of the key partners who were supportive of this. The aging advocates, we have someone from Old Rounds Legislature here, someone from Alzheimer's Association here, the Area Agencies on Aging, caregivers, and those are, I'm going to turn it over to them, but also those are just the aging advocates. We had a huge host of diverse groups of non-aging advocates had also supported it, because it's not just about helping someone who's older, but also helping someone of all age to make sure that they have the tools they need. So I think now's a good time as any to turn this over to, I'm going to start with Emily, if you don't mind. Emily's with the Alzheimer's Association of Iowa, and I'll start her third.
Hi, everyone. Like Anthony said, I'm the public policy director at the Alzheimer's Association. So I did work on this, and the Alzheimer's Association has been supportive of the CARE Act in previous years. And we were so very excited to see the successful passage of it this year. And I was happy to be a part of it as led by AARP. So glad we had the opportunity. And when it comes to the Alzheimer's Association's perspective, there are 65,000 Iowans living with an Alzheimer's diagnosis, but there are 136,000 loved ones that are caring for someone with this disease. And so that is where our focus is, not only on the individuals that have that diagnosis, but making sure the caregivers are set up for success in caring for those. And so that's where, this CARE Act comes into play, that like kind of Anthony has already presented on, but the majority of the caregivers that aren't prepared for a diagnosis, that maybe most likely don't have the healthcare background to kind of react to the diagnosis, while the hospital discharge, while what we're focusing on is just a small piece of that journey. If we can help in any way make that a better transition, help make it easier for the caregiver, lessen the stress for the caregiver, then that in my mind is a success, and that's where we can be helpful and where this CARE Act can be helpful. So that's from my perspective. I can pass it over. Oh, sorry.
Sure. Well, hello everyone. My name is Leah Donald, and I'm here on behalf of the Johnson County Task Force on Aging. And the task force is a local group here in Johnson County of volunteers, and we work to support the honorable mission of our local area agency on aging, which of course here is the Heritage Agency. And we are just very proud to support this wonderful event. And I'm with Bob. This is definitely call for celebration. So thank you for insisting on that, Bob. I'm just really thrilled to be here, and I also wanted to plug that we are always looking for new members. If you live or work in Johnson County and are interested in advocating for senior issues and supporting for the betterment of our elders, we would love to have your application. So come and find me, and I'd be glad to take it for you. I'm going to pass it on to Larry.
Thank you. I'm Larry Coogee, and I'm vice chair of the Older Iowans Legislature. We're probably not as well known as some groups that have worked with AARP on this, but basically the Older Iowans Legislature is a nonpartisan, nonprofit, grassroots organization. We usually have a session in the last week of September where we come up with issues. The CARE Act has been an issue that we've had on our agenda for a number of years. Bob Welsh is a member of our organization, and he and I kind of led the charge down at the State House, more Bob than me at the start, but we spent a little time together down there, and a lot of time in a car going down to Des Moines on this issue. So we're very happy. We're really proud of the partnership that we had with AARP this past year, and we've already had Anthony at our board meeting this past month to discuss how we can work together in the future concerning senior issues. And so it's exciting to know that it takes a little while, but their success can happen, and we really appreciate that. I'll just put in a quick plug. We have our annual sessions coming up September 24th in Des Moines. There's a handout that Bob has prepared out on the tables that if you're interested, it's really a kind of a neat experience. We actually hold our session in the House chambers at the state capitol. It is a one-day session this year. And we'll divide up into committees, come up with the issues, and then we vote on a priority issue. CARE Act has been one of our priority issues for a number of years, as has been elder abuse. Various aspects has also been another one, but there are other issues that are out there as well. So we would invite you to pick up the handout and look at that material concerning September 24th. But again, very much appreciate the partnership that we've had. We've also worked with Alzheimer's, been a member of Johnson County Task Force for a number of years as well. So thank you.
Thank you, Larry. Yeah, go ahead.
Pass it over to Marcy real quick.
Hi, my name's Marcy Durian. I'm here on behalf of the Johnson County Caregiver Action Committee, which Bob is also a part of. We like to talk about ways we can help people in the community, caregivers. One of the things we're working on now is getting out into trying to find workplaces that would like to have us speak about being a caregiver, with also discussing the CARE Act. And just quickly, from a personal standpoint, I am a caregiver to my 92-year-old father-in-law, who's actually moving today, has a radiation wound on his head that will always be there. And I am already working on getting that transition from one place to another, so he has the proper bandage change today. In addition, I always think of something Bob talked about in one of our Caregiver Action Committee meetings about the importance of people when they leave the hospital and knowing how to don and doff a brace, for instance. Bob used an example, a personal one, and I used to work in skilled rehab for many, many years, and I can remember there's so many different kinds of braces. And this was actually coming to skilled rehab, and some of us therapists weren't even exactly sure how this particular contraption worked. So it tells me that it's even more important that a caregiver going home has this ability to learn how to put a brace on, or to have somebody go from sit to stand. It can even be as simple as that. So I thank you all for your work for this. I think it's something that's really exciting, and it's going to help a lot of people going forward. Thank you.
Thank you. Thank you. And yeah, so you heard, these are just some of the voices that were very helpful on this to get this passed. Ultimately, as you know, as I referenced earlier, spoiler alert, it did pass, and that's a good thing. And I wanted that note just talk about the groups that, there was groups that supported it, but I also want on this note really applaud the Hospital Association as a group that I spent a lot of time talking to them, working with them, and I referenced this earlier, but I respect on any issue, when there's different sides of the issue, really, how do you come to agreement? That's the only way things gets done. So I really want to applaud them for working with us and working with the groups who are so interested and passionate about getting this done. They really contributed, the Nurses Association really contributed to getting this approved bill, I think, in the end. So that was a key point this year, making sure all the groups not just were supportive, but at least neutral. And ultimately, the Iowa Senate passed this bill in March 1st, and then the Iowa House followed its lead by passing it in March. And then Governor Reynolds signed the bill into law on April. And I have a nice little footage. I'll show it to you. But I think this is an appropriate point to maybe just turn the mic over. I'll walk around to our most senior member of the delegation just to share any thoughts about this and add to this. So we'll start with you, Representative Masher, if that's okay.
Thank you, and thanks everyone for being here today. This was no small task, and Bob can tell you, and Anthony and others who have worked on it, that it's, Carolyn said, what's it been, Mary, 5 years? I said, probably more like 10 from the time we initially started proposing legislation, and then really hard work the last 5, and the last year being able to accomplish it. So I want to, again, applaud everyone who had a part in that. You know, you'd think it's just kind of common sense, but the Hospital Association and the Nurses Association were both extremely concerned. The hospitals, because they said, well, we already do this. And we all kind of looked and said, well, when we talk to the caregivers, they're not quite sure you already do this. And there was a lack of consistency throughout the state. Some hospitals did it very well. Others did very, very little. And that's why we needed the law to protect everybody. So I look at, again, all of the hard work that went into this. I just spent the last week being a caregiver for a very good friend of mine who lives in Radcliffe, Iowa, on a farm. And he did not have any family members to care for him, but he had a team of friends that he has identified, and they are coming in to do the help. And I look around this room, and I know a number of you have been caregivers. Watching men put on support hose, can we just be honest? That is hilarious. And for women who have been putting on hose for years, no big deal, right? But to actually help men learn how to do that and to assist in that effort, because many of them have no clue that you roll up the hose first and then you lead it up the leg. But it's that whole thing of they don't know those very common things that, again, we figure it out, but sometimes it helps to have the people there who know what to do. So I was there to help him with his exercises, to help him with his medications. I did cleaning, the household things, all of those things that people need when they have friends or family members who are in those situations. And so I was glad to be there. The notebook that came from the hospital was impressive. He had another friend that helped him in that process, but then he sat down with me and went through everything. And we have a notebook there where we record everything, including when we gave meds, what his blood sugars were, because he's a diabetic. And so we watched all of that, taking his temperature regularly, just those common things that, again, caregivers do. And so I am so proud of the fact that we were able to get it accomplished, and that we are one of the states that can now say we have that CARE Act in our state. It was long overdue. So I will turn it back to Anthony, and I know Kevin's here, Zach is here. I also wanted to give out a shout to Pat Hayden. Pat's one of our county supervisors, and I think we missed her the first time around on our elected officials. But Pat, thanks for being here and for caring. We've got our director for public health here. I'm excited to see the faces in the room and the fact that you care as much as we do about this particular bill and having it passed. Thanks,
Thank you.
Anthony.
And thanks, Representative Master, for filling in the blanks. I'm so sorry I missed you there, Pat. So I'm going to bring it over to Senator Kinney and Senator Walls, so get me moving around.
Thank you, everybody, for coming today. This was legislation that, to me, was common sense. And Mary, I didn't know how to put on the hose because when I was playing football, I got hurt and I had to put hose on to wear underneath. So I did learn how to do that a long time ago. We got this passed, and I just want people to realize when you come together as a group, how much further you can get at the Capitol, and when you're able to kind of neutralize the hospital association, and because I think that they seen that it was coming because of the overwhelming support from all these organizations, and I just thank you for being here today, and congratulations.
Thank you. Senator, you're good. All right. Last but not least, Senator Walls.
It's true. Thank you, Bob. I appreciate that. I'm State Senator Zach Walls. Welcome to Senate District 37 here in Coralville. I want to start first by just making sure everybody knows I just finished my first year, and so I get zero credit whatsoever for any of the work that was done. I did not have the opportunity to work on this bill in committee, but I gladly voted for it on the floor. Bob and others were getting in my ear about this topic and how important it is to support caregivers from very early in the primary campaign, well before I was elected to the Senate. And I also want to speak just briefly to my own experience. Some of you know my story with my mother, who has multiple sclerosis. She was diagnosed when I was 8 years old. And even though I was very young, learning at a young age the importance, the role that caregivers play in supporting our loved ones, our family members, I did see the Multiple Sclerosis Society of Iowa was a supporter of this bill, and I was very excited to vote for it on the floor. So just thanks again to everybody who made this possible. I'm very excited to see the implementation move forward as we get all of our hospitals up to speed, making sure that they're disseminating this information. And just again, congratulations, and thanks, Bob, for insisting on the celebration.
Well done. Thank you. And with that, I do want to, I see if Bob has anything to add. I will say this, thank you again to the lawmakers who are here. I'd be remiss if I didn't point out this was a bipartisan bill. And, Senator Bolcom obviously voted for this. Representative Lensing voted for this as well. So, and also did Representative Kaufman, who, again, in the majority in the House, what's that? And thank you, and Representative Jacoby. All of your delegation voted for it. But I think the key I wanted to make sure is this was a bipartisan bill and a bipartisan vote. So, and a good example of that. And Bob, what did I miss? I know there's a lot of things I missed. I'm gonna get into what's next from this, but I want to turn it to you, Bob, if you want anything to add.
One of my most disappointing experiences as a caregiver was when my wife had hip replacement and I had the task of putting on the hose. And it was disappointing to me because when she went to the doctor, she complained about that. And the doctor said, "You don't have to do that anymore." And I was really upset because I enjoyed that at my age. Anthony, let me ask you a question.
Yes.
If my wife is getting discharged and they say, "I need to do this and that," and I say, "I don't think I can do that," will the hospital tell me who can help me with that?
Yes, that is one provision of Bob's question. If y'all heard it too, is if there are limitations, that is one of the key parts of the CARE Act, that there's a discussion of limitations for this very situation. So this is provision 3, which does say there is a discussion, a required discussion with the hospital on what the caregiver's capabilities and limitations are. So there is a blanks filling in. At that point, when you say, Bob, "I cannot do this," that is incumbent upon them to connect you with what resources available, who you can connect with. Maybe it's the area agencies on aging, maybe it's the visiting nurse services. So there's flexibility. I can't speak to what exactly I can tell you they will do, but what I can tell you is there's a requirement at least to have the discussion and awareness, and then have the local provider, help fill in the blanks. That was actually one of the key things that was discussed all the way to the end, because to make sure that was part of it and how well it's done. So yes, any other questions about that? I kind of just jumped over the CARE Act, but go ahead, ma'am. I'll repeat your question.
What are the expectations when you have a medical power of attorney and they're not going to be the caregiver?
I'm glad you asked that. Wow. I saved another half hour because I'd love to talk every ins and outs, but no, this is a very important question. The medical power of attorney, let me start. The question is, what happens if there's a medical power of attorney in play? The short answer is nothing. It does not change that. In fact, we had very careful steps to make sure that it doesn't give any new legal authority to the caregiver, in the sense that I am now the medical power of attorney, I am now a guardian. All it says is this is the person that I want to help me, and again, makes it HIPAA proof that you can share information about my medical care with this person and involve them. But specifically, a little bit step further, it doesn't change medical power of attorney at all. It does actually. One of the things, we have one of the more thoughtful substitute decision maker process, in that you might be in a situation where if there's someone that goes into hospital who has a guardian and they're incapable of saying, who do I want to care for, it actually goes first. You have asking the guardian if they would like to designate a caregiver. So there's the option first of a guardian, or then a medical power of attorney who can make that designation. But it's clearly laid out. In fact, it's spelled out. We added a line. It does not grant any new legal authority to control what you do or don't do. All it is the designated caregiver, and I shouldn't say all because it sells it short, the person that you are putting in your medical record as the person who can get information about you and get instructions about you. Thank you for that question. Does that answer your question? It does not change the medical power of attorney, impact it one way or another, other than they are one of the people in line to be able to do that designation, should you not be able to do that yourself.
So if they're going to hire somebody to give your care, would the hospital want to interact with that hired individual who's going to get the notebook and go through the notebook?
this is not a hired person, by the way. This is by definition a lay caregiver. If you're being discharged to a medical, professional home health care, that's a whole separate process, because that is, but they have whole obligations, requirements. Again, we spell that out too. It does not interfere with someone who's being discharged to the care of a paid professional. This is for the majority of people who are going home to lay caregivers, actually how it's defined in our code. So it means someone who is not by definition professional, someone who does not have a legal contractual obligation to provide care. Does that clarify? Any other clarifying questions? Okay, well, I want to have more of a discussion, and before I get to that, I just want to, we have a nice video to break it up. Hopefully the sound will work. If not, we'll just go with it. That kind of highlights some of the work on this bill.
Welcome and thank you all for being here at AARP Lobby Day. It is awesome to see a sea of red. We've been at this for a long time now, but it's really a credit to everyone here that we've made it this far. This is the year that we're going to get the CARE Act signed into law. I believe that.
We're here today with AARP Iowa and its volunteers joining Governor Kim Reynolds to sign the CARE Act. We've been working on this for 5 years and we're just thrilled and excited that it's passed, and now we can let everybody in Iowa know it's there for them.
I am proud to be able to sign this afternoon Senate File 210 on the Iowa CARE Act, a bill that's intended to lend support to Iowa's 317,000 family caregivers.
So look, I don't have much more to say other than we are transitioning into the implementation. That's really kind of build up to, we're not selling it anymore. It's now talking about what the CARE Act means. This is very much the phase of education and outreach, and then making sure the CARE Act is integrated into the hospital survey. So how do we do that? First is making sure we're building awareness. So events like today, if you've seen some spots in the earned media on TV, we need your help to really help build awareness of this. And then again, there's lots of follow-ups. I know Representative Masher talking, there's always ways you can improve legislation. So, but right now we're not looking at improving legislation. This is the law, and we want to make sure people understand it is really much the phase we're in. Of course, there's more that needs to be done. I know hopefully all of you are AARP members. I know it was invited a broader universe, but one of the key things that we want everyone to take home with you, if you did not do so already, is take home this nice informational flyer. And it has a terrible wallet card that you can take home, put it in your wallet. There's two, so you can put one for you, one for a friend. Grab these. These are great tools. Again, we stole this idea from Kansas and Nebraska. That was a very popular tool that they've used to help educate the public about what the CARE Act is and why it's so important. We did mail that to our members, and so that if you haven't received it already, you should be getting a copy of that. We've emailed it to members too, so you can get it that way. We're trying to spread the word both to the public as well as to our membership by emailing it, mailing it, the wallet card flyer, providing posters, and then really where you come in, outreach with partners and help is needed to help spread awareness. For those of you, I'll put a plug. Julie's our communications person. Those of you see anything about this on our social media, aarp.org/IA. Our Twitter account is just AARP Iowa. Very easy to look up. To the degree we have anything out there, just promote it and saying, hey, yeah, this makes a lot of sense. We need to help spread the word about what the CARE Act is. And then last but not least, partners reaching out. I know Bob did a really nice op-ed that was printed, I believe, in the Press Citizen that promoted this event, as well as the CARE Act. And then just any other ideas you can help us to help spread the word. So it's very straightforward. With that, I'll open it up for questions and discussions from our panel, but that's it. Any questions on anything we've talked about? Yes, Representative Masher.
Anthony, AARP works on a lot of legislative issues. Bob's been involved in those for years as well as a lot of people in the room. What are your next
legislative priorities that we need to be thinking about, and obviously the legislators need to be actively working on.
Great question. So the question was, what's next for AARP? Before I get to what's next, here's our website. AARP.org, IA talks about all the good things we're doing in Iowa. Our AARP.org IA CARE Act 2019 is where you can find that wallet card, watch videos, kind of talk about, it's a nice background piece. To answer your question is what's next is lowering prescription drug costs. That is something we're working very hard right now on the federal level, but we hope we can get something done. There was some discussion last session on lowering prescription drug costs. That's one thing. That's first and foremost. The second piece is hope to work with some of the same partner groups who helped us pass the CARE Act on looking at home modifications, right? Tax credits. That's something that we were supportive of and signed on in the past, but hopefully now we can transition to get some momentum. That's at the State House. And I will say, I mentioned the CARE Act. It is just one piece of supporting caregivers. There's the financial side, because to this woman's point, this is not someone who's getting paid to do it. In fact, it's usually someone who has another paid job or has to take time off from their job to do so. So looking at tax credits in the State House, there's also federal legislation to look at a credit for caring tax credit, bipartisan bill that we're working to get, trying to get moving at the federal level on caregiving. But I'd say prescription drug costs is one, the financial side, for lack of a better term, at the State House. And then I would look at elder abuse as something. We tried to get over the finish line last year, restoring the criminal side of it that got lost along the way, working with the Attorney General on getting that piece of it restored. I didn't talk about, but a victory that was also, thank you all in here, lawmakers, improving our guardianship and conservatorship laws was something that passed last year. Maybe that's not something on your radar, but for someone in a guardianship or a conservatorship, it's a really big deal to have better protections for them. That passed, but there's just a myriad of ways we need to better combat elder abuse, both from the criminal side. I know Senator Walz has legislation look at mobile homes, the problems with mobile homes affordability. That's certainly on our radar. We try to narrow what we do, but inevitably, as you know, both members in here and lawmakers, we get asked to get involved in a lot of things. I wish we could, there's always so many things that more I'd like to do, but I would say leading point is prescription drug costs, other ways to financially support caregivers, and elder abuse. Home contractor fraud is another thing I would put in the mix too. Those are probably the big buckets, I think, what's next, but certainly leading prescription drug costs, because we know that's a top of mind healthcare cost issues that we really need to rein in, and other states are actually ahead of us in trying to lead at the state level. I would like to get something done in Congress. I don't know, whether we get that done or not. There's certainly more we need to do at the state level on prescription drug costs, elder abuse, I would say, and the financial side. What I miss? You want to mention? Yes, Larry.
Not only is AARP involved on the criminal side of elder abuse, but also Anthony and Bob and myself and a Department of Aging, as well as various other departments, have a working group that was put together by the governor to deal with the civil side of elder abuse and the lack of a comprehensive approach to elder abuse. And back in 2013, there was a task force at that time that identified some things in the area of elder abuse, and some of those things have been accomplished, some have not. So that task force has had a preliminary meeting. We meet again next week in Des Moines to hash out some issues on that. And the long-term hope is that the governor will do what she can through executive action. If it's not through executive action, perhaps there can be some legislation proposed by the governor to the legislature. So that's in the mix as well, and Anthony's a part of that.
Thanks for that reminder. Any other thoughts, questions? Yes, ma'am.
Is there anything going on to help afford, to encourage building for senior communities where you're not ready for assisted living, but you know you shouldn't live in your home anymore? There's a big, huge lack of it here in Iowa City that is senior affordable housing. There's waiting lists and everything, and there's lots of high-end properties, but nothing for lower income.
So your question is about affordable housing, especially for people as they age, so they can stay in their home. I think you are right. This solution is largely, there are things that can be done at the state level, but from our experience, it is largely a local issue. Now, that is actually one of the things I mentioned briefly at the top of my presentation, is we are looking to figure out how we can better partner with those communities who are trying to do a better job of dealing with this issue. We have a very we have a very old housing stock in Iowa. I know about 5-10 years ago, one of the data points I recall, at one point, and maybe it's outdated, but we're still up there, we had one of the highest percentage of homes built 1965 or sooner, and that's a percentage-wise. So it is, on the one hand, a very much local issue that we, if there is an opportunity for us to partner, we are open to that. Now, look to Julie. I know largely what we've been doing, some of that is in the Des Moines area. But I would say is, I go back to full circle, we're a staff of 5, so if that's something you want to do, let us know what is afoot and how we can help, and maybe work with Jeff on that. So let us know what opportunities exist. We'll try to figure out, we have a lot of great resources. I'm one person, but we also have a lot of great background and policy to help guide municipalities and local groups who are trying to work on it. But it's a very long way of saying is, yes, that's something that we would like to be helpful, but we really need, especially where it's local, we need local leaders to really lead that we can help support them on. Does that answer your question? So it is, your point is absolutely well taken. There's not enough communities that are even thinking about what they're doing as it relates to housing stock and what that means for someone to be able to stay in that home versus having to go to a nursing home or create new. I think what you're really also getting at, building some newer housing stock that is a newer type of home that's not assisted living. Is that fair to say? And thinking how you set up those types of communities and livable spaces. So, yes, ma'am, you, and then back to you. Yes, go ahead.
I know there's other states that completely exempt pension income from seniors' taxable income for the state level. All Iowa offers is a $6,000 deduction. Is anybody considering expanding that $6,000 deduction to help the older Iowan?
So pensions phase out. Yeah, they raised it. Yeah, they phased out Social Security tax. I was there when that started, and that's now full effect. And during that same time, they also increased the deduction for pensions. I know it was part of the discussion. It's been in and out of at least the Senate's version of tax reform. I will just say that's in the discussion. Where it goes and how far it goes, I don't know. Did I miss something on that?
That was accurate.
Thank you. That's the best way to summarize it. I don't know. Yes, ma'am.
I know of a community in central Ohio that has apartments, zero lot line, and individual cottages, one floor, and they have people of all ages living there, and my sister-in-law bought into it and really likes it. She's on either side, 3 feet from her neighbor cottages. There's just a small front yard, small backyard. It's an association, and they pay for snow removal and grass lawn mowing. And she really likes it because she's there with a wide variety of people of all ages. So she doesn't feel like she's old, just shut off with people her age. And it's affordable, and everything in her cottage is handicap accessible. And we've been looking around for that type of housing in Johnson County. We'd like to see that because we'd like to be in a cottage like that. That would be wonderful for us as we age. And I don't know that there's anything being built in Johnson County like that right now. We went out to Tiffin to look at something that was advertised as handicap accessible, and we didn't think it was all that handicap accessible. And there needs to be discussion of that.
So I think I'm going to hand it over to Jeff because I was going to do this even before your question. One tip on this, I would say. I think it's always, there's always the big solution, but there's also things you can do already. Like you mentioned, Grab Bar. I mentioned that we're supportive of policies to tax credit for home modification. I share the anecdote. My parents moved off the farm. They built a house that is main floor accessible. I'm one of 9, but so they can expand for people around there. But I tell the story. They put in a nice accessible shower, and they put in a Grab Bar that came as part of the walk-in shower. But I said you really should put one more Grab Bar right here as you walk in. And my parents are like, well, it's $100, da-da-da. I'm like, why would we put this extra in? There's already one there. And then, almost weekly, it's like, well, sure, glad we put that Grab Bar in. So I'll just say it starts small even with your own home, before you get into actual relocation. Invest in ways to make your home safer so you can stay there. It's just my one tip, but I'm going to turn it over to Jeff to talk locally.
So kind of going to your question about, or comment about a lack of, I think just kind of housing, cottage style housing for all ages, intergenerational really. And that is something I think that a lot of people are looking at. I think Prairie Hills co-housing would be a newer type of development that's come up that is trying to encompass that type of a style. I couldn't speak to the full handicap accessibility of that particular development, but that idea I think is something that is welcomed in the community. I certainly will take that back to our Livable community and our Board of Supervisors, and I know with Pat being here, Pat's obviously well aware now of what you're saying, and Pat has a wealth of knowledge when it comes to older adult issues, trying to figure out, what kind of housing, how we can kind of help out with some of the affordability and housing accessibility issues. There's a lot of issues. It's such a complicated, very, very complicated issue. But I know that it's almost time that this event is up. I really wanted to thank Anthony from AARP Iowa for we could do a long Academy Awards of thank yous. Bob, thank you, Bob. All of our panelists, our legislators, all of you for coming out here. I guess last but not least, I wanted to just kind of mention, because I didn't do it at the beginning at all, my position with the county as an aging specialist. I am here as a resource for those living in Johnson County to be able to call with questions. Not sure where to start even. Oftentimes people say, I don't even know who to call or that I should call anyone. Feel free to call me. There are a lot of wonderful resources that we have in our community. The Heritage Agency, our area agency on aging. Maria is here, that's why I keep looking back there. They're a wonderful resource, particularly for those in, not just in Johnson County, but they cover a 7-county region. We have other wonderful providers. Horizons Elder Services, Doreen is here from there. Marcy from Livable Seniors. There's a lot of wonderful providers. I'm happy to help get you connected with those different resources that exist in the community. But thank you all for coming today.